Welcome back, everybody. Dr. Ricky from Scottsdale, Arizona. I appreciate you guys joining me on the page today. If you haven't seen any of our past videos, why don't you scroll back, take a look. We have some good ones there. But today, I've got a great episode of Botched ready to show you guys. Something that I commonly do in my practice is revision breast reconstructive surgery for cosmetics. So people will have a botched breast surgery by another surgeon and they come to see me to fix it. I enjoy those cases because they're very complicated and they require a lot of thought and skill and planning to complete. So I've chosen a really good case today off of Botched, and I want to watch the episode with you and go through it and talk about some of the things that happened to her and some of the ways that I would have handled the problem, as well as to go to the end and see what she actually had done. So join me today to watch this episode and let's learn something.
After my first year in law school, I figured I made it through first year, which is the toughest year, you know? I decided to reward myself with a breast augmentation. I had the surgery in the summertime. About 3 to 4 months into it, it got really hard and raised up to here.
Okay, what she's describing here is when we go to place the implants underneath the pectoralis major muscle in the chest, sometimes they're placed above, but irrespective of that, when we place an implant into the body, you form what's called a capsule. And that capsule is similar to what I would say is an amniotic sac around a baby, where you form your own tissue layer around the implant, and that is your own tissue, and it basically occurs because the body is saying this is foreign and it's not supposed to be there, and so it will wall off the implant from the rest of the body. Now something can happen called capsular contracture, and that just means that the sac that surrounds the implant for whatever reason can start to become tight and can squeeze the implant, and when that happens, when everything tightens up, the implant gets drawn up high like she's describing here in the video, and that's a problem that has to be taken care of, usually by going back to the operating room and removing the scarred capsule that surrounds the implant with the implant and placing a new implant, and then you form a new capsule, and usually everything is fine.
I went to another surgeon and he said, yes, we got to take that out, clear out that scar tissue.
Right.
He put different implants in, and honestly, they were fine for 12 years.
Okay, good.
Up until, I guess, one of them ruptured. I was happy until the day I woke up and there was just a bag.
So did it go flat right away?
In about a 48-hour period.
Okay.
So what's happening now in this video is she's woken up and one of her breasts is deflated. And so there's a couple of things. She hasn't really said yet whether she has a saline type of an implant, which is basically a silicone shell filled with salt water. This is a sizer, that's why there's a hose attached to it. And then there's the silicone type of an implant. Now, typically what happens is if it's a saline implant and they wake up and their breast is deflated, generally this implant will rupture, the salt water leaks out into the pocket, your body will reabsorb it, but the breast deflates and you're like, that's not normal, and you know right away. Today with silicone implants, we're on our 5th generation, and these are the gummy bear type gels, so if you cut these in half, they don't just ooze everywhere, and so typically to know if one of these is ruptured, you generally need an MRI, and you may not know for several years because you could have a little pinhole in the shell and nothing leaks out. So most likely what she had was saline implants, but that's what happens with implants when they rupture, and the rupture rates are generally about 1% per year. So at 10 years, a 10-year 10% rupture rate. So let's watch the video now and see what happens next.
When they pop, you just got to get them replaced.
That surgeon moved, so I went to another surgeon. And he didn't even use the right type of sutures. The holes where the sutures were placed were really large.
Okay, this is a good time to pause and talk about a couple of things that are going on here. I want to talk about the different types of breast lifts that we can do, and I also want to talk about sutures and what might be going on with the starburst pattern that she described. So there's 3 types of breast lifts that we typically do. When a patient has the nipple drop below the breast fold, which is commonly seen in women who've had kids and they've breastfed, we need to tighten up the skin envelope, and there's 3 ways to do that. One is by making an incision like shown here that goes just around the areola. And that's called a peri-areolar lift, where we just take a wedge of skin out surrounding the areola, and then we tighten everything in really cinch tight to bring the skin tighter towards the middle around the new areola. And that's what it looks like she had done. The more common types of lifts that I do in my practice and I see is either one, the lollipop type lift, which you can see is just an incision that goes around the areola and then down the vertical portion of the breast. And the most common that I almost use every time is this type of lift, where we do an anchor incision. So there's an incision that goes around the areola, a vertical scar, and then one in the fold. And the reason for that is we generally need to, number one, slide the nipple up into its new center of the breast. Number two, tighten up in the vertical plane, but then also tighten the breast up in the horizontal plane. So those are the three different types of lifts. Now, the one that I least do or hardly ever do is the one that I think she had, which leads me into the next thing that I wanted to talk about very quickly, was the type of sutures that she used and what might have caused all those little holes that she has. So when they actually cinched her breast tight with implants, it created a lot of tension. Scars don't like to be under tension, and so what can happen is it can pull apart very easily with that peri-areolar approach. Now, a lot of times patients will say that they are allergic to sutures because they started to come out through her skin. It's not really an allergy. We do most commonly use dissolvable sutures in a case like this, and the type of suture that I use and that most people use will dissolve over the course of 3 months. The problem is, if you have really thin skin and there's a lot of tension, your body can try to reject those sutures because it's trying to chew them up and get rid of them because they're a foreign body. And essentially what happened to her was, that's called spitting a suture. Her body tried to spit all of those sutures out, which left little wounds, and then when they healed, they left with this starburst pattern that you saw that she showed. But there is a good way to fix that. So let's see what happens next.
About 3 weeks after, stuff started leaking out. I mean, I filled up a Tupperware container with just going like that to my breast.
Pus?
It wasn't a pus, it was more liquidy.
Little reddish?
Yes.
Yeah, this is one of the most devastating things that we can encounter in plastic surgery, is when someone has implants and then they get a fluid collection that can potentially become infected. So, when we do these big revisionary cases, it's like a huge wound inside of the breast. And so what happens is your breast cells internally create fluid, and that's oftentimes why we'll place a surgical drain into the pocket with these complicated cases to drain some of that liquid out. Now, I don't know what happened with her other surgeons, but maybe she didn't have a drain, and it sounds to me like what she got was a seroma. And a seroma is just liquid-filled pocket with fluid. Normally, there's no infection. Typically, if a seroma becomes infected, it then can be pus and can be something called an abscess, which is a really devastating complication. And so things that we can do to fix this, number one, if it's a non-infected seroma, we'll oftentimes just drain that liquid and maybe leave a drain behind and the implant. But if she has pus in the pocket with an implant, those implants gotta go.
I went to see a different doctor who said, listen, I'm taking these things out, put me on antibiotics.
Okay.
And now I kind of just stopped my whole life.
You did because of this? Yeah.
She's literally in her room.
I am.
And you're living alone or living with
I
mom?
moved back in with my mom. Everything that I was, I'm not.
Yeah, look, these are real life cases, and I see this all the time. And there's two things here. These are very emotional for women, and the problem is when these devastating complications happen, you lose your sense of self-confidence in your body and who you are. And so this is a case where, as a plastic surgeon, I love my job because this is fixable. There's definitely things that can be done to fix her, and we get the chance to give these women their lives back. And we all know that how you look and feel in your skin and your body really carries over to how you act in your relationships throughout the rest of your life, how you act around the people at work. So this is a great case, and the good news is that there are definitely things that can be done. So let's talk about, if this was my patient, what are the things that are going through my mind that I think could be done? So in her case, she's had enough of a holiday from having implants that the risk of infection, again, is not very likely. Her body has probably cleared the bacteria out of the pocket, whatever has been going on since she got rid of the implants. So in her case, what I would discuss with her, based on the previous pictures that I saw in the video, is I would probably be offering her a full anchor lift like I talked about before, or potentially the lollipop lift. Now this also depends on how big of an implant she wants. So I would talk to her about the size that she's looking to be. We would select the best implant for her, whether that's silicone or saline, go place those into the pocket. Sometimes once we do that in surgery, they don't need a lift because they fill out their skin well enough. In her case, I have a pretty good idea. She's gonna need some kind of lift. Now, sometimes those can be staged because we worry about nipple blood supply when we're doing a case like this. If I can do it in one stage, I would most likely go in, place the implant, do the lift at the same time. And there's one other thing that I would probably discuss with her based on what I see on her physical examination. Sometimes women don't have really good soft tissue support. And so in those cases, what I will offer them is a piece of mesh where we do something called an internal bra. What an internal bra means is that we need to support the internal breast tissue because it's so weak and thin over time that the implant is just going to sink and bottom out into the lower part of the breast. By using a piece of mesh like this, we can suture this into the pocket around the implant in such a way that it acts as a hammock to support and hold the implant up. There are other ways that you can suture this in, but this is commonly how I sew it in place. One thing you might be asking is, well, doc, can this get infected? Well, the kind of mesh that I use, this particular mesh, it reabsorbs over 18 to 24 months. And what happens is your body will grow its own tissue into the mesh. And once this dissolves and goes away, you're left behind with your own body's tissue internal bra. So some patients need this, some patients don't need this. So that would be what I would offer her most likely. And obviously that would depend on what I see on physical examination. All right, everybody, I hope you enjoyed. That was a great episode. Again, remember, please comment, like, and subscribe to my YouTube channel if you like these videos. And hey, if you guys have other videos that you want us to make sure you email us here. And if you have questions about this particular episode, you can send us an email as well. Also, I am active on both of my big social media accounts. You can follow me on Instagram and TikTok. I put a lot of great content on there. But for the time being, Dr. Ricky, out.